This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app.
Good morning, everybody. So today's topic is on complications in spine surgery. And it's one of the hardest topics that I live with, one of the things I live with every day. And everybody else does too. Anybody who's had surgery, who hasn't had a perfect result, is frustrated and still has pain and has issues. And that's of any body part, but especially spines. Having neck pain or back pain affects everything you do in your life. And we get some people who are really desperate. They're suffering, they're in agony, who come in to see us who can't do anything, and they want to get cured and they want to get fixed. They want to get back to their life. And so usually surgery helps 80 to 90% of the time, but that still means 10 to 20% of people are going to have issues and have pain that we can't always fix. And it's one of the most difficult parts of my job and one of the most difficult things that I experience every day with people who are suffering in pain, who have had surgery, either by us or by somebody else, or still having issues. So I want to kind of give you an idea as to why that can happen. What does surgery do? What does it not do? Now, granted, this is an 8-hour all-day seminar that we speak at and we go to, and it's part of our business that we do. And I'm going to try and do it in like 15 minutes and just give you some idea. I mean, that's one of the most powerful things about Facebook Live and about podcasts and stuff I love, is that I can hit a button and at least share some information, and it only takes me 15 minutes and maybe it'll help. So one of the concepts is I've done a perfect surgery on somebody. I'm not always perfect, but I can guarantee you I've done a perfect surgery on people, that the same surgery I've done 1,000 times, the same surgery I would do again the next time. And sometimes people wake up and have numbness or tingling symptoms, anything that I can't explain. Sometimes that just happens. That's part of the risk of having surgery. We don't have 100% outcomes. My job is really an odds game. What's the chance I know what's causing your pain? What's the chance the surgery I'm going to do is going to help you? And is it worth the risks of the surgery to do that? And we evaluate those odds. If I think those odds are good enough that I would have the surgery on me if I was in the same situation, that's generally when I recommend surgery. But part of the reason why I do these podcasts and Facebook Lives is just try and help educate people. Because the biggest thing that I see is the disparity is that most people aren't educated. So they have unrealistic expectations, good or bad. Some people say, I'm never going to have surgery, period, because my mother had it and she ended up being awful. And they've got some stenosis at one level that we can fix in 45 minutes as an outpatient. And I'm kind of like, I don't want to talk anybody into surgery, but you should have surgery. This will help you. And then the flip side is some of my most unhappy patients are people who have come to me and wanted to have surgery and wanted to be fixed, and they were mentally and emotionally ready. And I've told them, look, I'm sorry, but I know you're suffering, but you shouldn't have surgery. I don't think surgery is going to help you. And those are really tough. They're tough decisions. You have to have alternatives of what we can offer. And that's part of what our app and our podcast help with is, well, this is what I recommend. We're not just going to abandon you and throw you out on your own. This is what you can do, and maybe you can get your pain 30% better. And that'll at least help somewhat and avoid surgery. So please click on the link below. I'll post a link to a video I made that goes in more detail about when you should have surgery, when you should not, and how we can potentially help. But I want to talk about the complications because they're so important. I mean, and again, it's a huge topic, but I think it's important to understand that our spines are aging. You've got discs and joints and nerves, and they peak at age 28, and it's all downhill from there. Aging sucks. Believe me, I'm 47. I felt it in the past 10 years. I can empathize and relate. You get pain sometime that will last a year, and then eventually it goes away. Sometimes it never goes away. Sometimes you have surgery and you still have some pain. I've lived it. It happens. And so it's important to understand that these joints are falling apart around age 28. That's why athletes peak around age 28. By 40, they're washed up. And so the rest of us, we're going to live till we're 80 or 90 because we're so healthy. We take great care of our heart and lungs. Well, our joints are falling apart around age 30. We got a long way to go. And I don't mean to be pessimistic. It's not just a downhill slide, because fortunately, we've learned a lot of things we can do to decrease from having pain and how to be healthy. We know to not eat too much. Don't be obese. Keep your weight down. Do some cardio exercise 3 to 5 days a week for 30 minutes. Low impact. Get your heart rate up. Break a sweat. Decrease stress that builds up in your body. Meditate. Get a massage. Relax some of that muscle tension that builds up. And so there's different things you can do to help mitigate these things to hopefully avoid having surgery and to live and have a healthy life. But at the same time, I see people in their 30s and 40s that have real degeneration of their spines, and they're shocked. They're like, how could this happen to me? And I say, well, because you're human. Because it starts aging at 28, and now you're 40. That's 12 years of wear and tear that it adds up. So that's one thing people have to understand, is that we're still living till we're 80 or 90, and we don't have a cure for that. Maybe stem cells and some other products will help us out in the future, but as of today, they don't. Stem cells and HGH and all this kind of regenerative medicine has not been shown to stop the aging process. Not yet. We may get there, but it's not there yet. So when we talk about surgery, here's another fundamental concept is there's 4 main reasons for pain coming from your spine. There's the disc, 2 facet joints for every disc, and then there's nerves that come out. Nerves in the canal, central canal, and nerves in the foramen, in the holes where they come out. Those are 4 sources of pain within here to here, and look how many different discs there are. You got 5 discs, 10 facet joints between here and here in your lower back. Lots of potential sources of pain. In general, surgery works best if you have pinching of the nerves in the canal. That's when we do these little microscopic laminotomies, go in and make a little more room for the nerve. That's the main surgery we do on professional athletes, and we've had about 85 to 90% return to professional sports afterwards. That's a great surgery, but not everybody has that. Most people have wear and tear of the disc and of the joints and pinching of the nerves way out here in the foramen. See, the issue with the foramen is if you've got foraminal stenosis, where this foramen is collapsed down due to the loss of the height and the degeneration, if I go in and try and shave down some of the joint to open up the hole, guess what happens when you stand up again? It just closes down again. So foraminal stenosis, where the nerves do get pinched, is not well treated by microscopic surgeries in general. So 3 of the 4, disc pain, facet joint pain, and foraminal stenosis, don't get well treated by microscopic surgery. Those generally need fusion. Now we're talking about screws and rods into your back, which actually works. I mean, we put those in with a computer, minimally invasive, and it can really help people, but it's a big deal. There's a lot of potential complications of doing fusions. We go from the front, the side, the back. You know, you can have organ problems, ileus, stroke, heart attack, death, all sorts of things can happen. So this is a big deal, but at the same time, it can still help people. So going back to the model here, 3 out of the 4 aren't treated by the microscopic surgeries. Now, we still do them, and that's our number 1 surgery of choice, because generally, if we make some more room for the nerve, then people can do all the non-operative care, the rehab, get your core strong, do everything else to help decrease the arthritic back pain from the disc and the joints. And the other thing I'll say about this foramen is if you have a disc herniation in the foramen, I love those surgeries where we go in with a tube at about a 30-degree angle and make a little hole here, take out the disc herniation, which is an amazing surgery. So we have a lot of different techniques, things that we can do, but that's one of the reasons people can still have pain. And I tell people all the time that in general, our results say of like doing a fusion, people's pain averages an 8 out of 10 before the surgery, and it averages a 3 out of 10 after. And I love knowing those numbers. That's why we do research, is so that we can know our results, know our data, so we can share it with people, so they don't have unrealistic expectations. If you're at a 7 or 8 out of 10 walking around and you've done physical therapy and tried everything and it's not working, your options are live with it or potentially have surgery. And in general, if your pain's a 7 or 8 and we do surgery, we get your pain down to a 2 to 3, which is a great reduction that most people are happy and they would do it again. But what does a 3 out of 10 post-operative mean? That's the average. So it means some people are at a 1, some people are at a 5, and equal on both sides, right? The 3 is the average. So most people still have some pain, but usually it's manageable and you can get by with it. But the important part is we never know how you're going to end up. Are you going to be the 1? Or are you going to be the 5? Or maybe you're still going to be an 8. We don't know. That's a chance we both take when taking on surgery. So comes back to the education. The video I have below will help educate you as to should you have surgery or not, what it does, what it doesn't do. How about complications in the surgery? One of the complications we can have is a spinal fluid leak, and that happens, it's reported 5 to 10% of the time in spine surgery. And basically, we're peeling all this inflammatory, arthritic growth that's pushing down on the nerves, disc herniation pushing up, and we peel that stuff off the sac that covers the nerves. Well, it's kind of like taking a sticker off a cardboard box. Sometimes you pull it up, it comes right off. Other times it's stuck, and you have to go to the path of least resistance and really be very diligent and take your time and free it up. And sometimes it's going to tear anyway. Well, if it does tear, we see the spinal fluid leak and we fix it. We put stitches in them, we put glue, we put a patch, stuff like that. Now, I've had patients who have had symptoms from a spinal fluid leak after the surgery that didn't have a leak in the surgery. And those are tough to deal with. So that's one example. Another example is people waking up with new numbness, weakness, pain after the surgery that they didn't have before. And I've done literally a textbook perfect surgery on somebody because I remember the surgery. We did exactly how we always do it, very uncomplicated, very straightforward, and they've woken up with weakness or numbness or pain or some types of symptoms. And I've had people say, well, how could that possibly have happened? You must have messed up. Somebody must have dropped something. Somebody must have nicked something, which is a normal human, response. Something must have gone wrong. The reality is no. Sometimes we've done a perfect surgery. People wake up and have symptoms. One of the reasons why that can happen is your spinal canal is this tight. It really gets narrowed. It's supposed to be normal, and over years it closes down, or a big cyst happens and it closes down, pinches the nerves. So in 30 minutes, we open it back up to normal. So it goes from that to boom, like that, and normal. The blood supply to the nerve, which is occurring on a microscopic level, may get interrupted, may get changed, may get altered. It's like a stroke of the nerve and the blood supply to the nerve that we can't always explain why these things happen. So sometimes people can get symptoms and you may get an MRI. Sometimes you see inflammation on an MRI. Oh, the nerve got inflamed. And so hopefully it'll settle down with some prednisone and maybe an epidural in time. But sometimes the MRIs look normal and people have symptoms. Well, that's one of the reasons why, is because we've changed the environment. And nerves are a little bit unpredictable. We don't always know. Usually we take the pressure off them. They're happy. They're helped. Other times they freak out and then they have complications. They don't work right, and we can't explain that. And it's one of the tough parts about my job. It's one of those X factor unknowns that we can't always control and mitigate for. What else? What about numbness and weakness? One of the things is that numbness and weakness may be permanent. If somebody gets a disc herniation and this disc breaks off and hits the nerve, it may traumatize the nerve so significantly that we may go in and take the disc herniation out, and our post-operative MRI looks great. The piece is gone, just what we planned. Somebody still has the numbness and weakness, and it may not ever get better. It's because the nerve was traumatized in the original event, and the surgery just didn't help. That's pretty rare. I mean, most people, nerves have 18 months to regenerate, and even up to 2 years at times. And so you got to give it time, because most of the time it bounces back and things come around, but it may not always end up normal, and it may not improve at all. Again, it's just one of the risks of doing surgery. And one of the biggest things I learned from my dad is one of the most important things about doing this job and doing any job. I know no job is perfect. Everybody has complications. You could always think you could do better. You're always trying to get better, whether you're a water polo coach, like my buddy Shondor, or any job. You always think, maybe I could have done better, maybe I could have done differently, and we always try and get better. But the bottom line is, if things aren't going well, and maybe you have a complication, one of your patients is suffering and still in pain and having issues, is one of the biggest things I learned from my dad is, your job is to make sure that person never feels like they've been abandoned, that you hang in there and you live with them and take care of this problem as best you can. Because this person is suffering, they're scared, they don't know what's going on, and they want help. And maybe I can't help them to the degree of I can't do another surgery to fix it. Maybe it is something that we're just going to both have to live with. But at least help educate them. Call in consultations if they'll help. Do whatever you can to help this person, because it's still just a human experience that we're trying to get through this thing together. And, most people recognize that and appreciate that. And it's my advice to young doctors and young surgeons is you're going to have complications. You're not going to have perfect results. Nobody does. That's part of being human and part of this general experience. But the biggest thing you can do is stick with people and do all you can do to help them. And that's what we try and do. And part of that is, we're limited. I can't take care of everybody. I like to spend a lot of time with patients, and I like to educate them. I love this Facebook Live and my podcast, which is Dr. Robert Watkins, because I can at least click a button, spread some information, and it may help. I can spend 15 minutes, and it may help 50 people for 15 minutes. And so I can maximize my time and spread it. But as far as one-on-one with people, if I operate on people, I take care of people, I want to be able to spend the time with them. And so I'm limited in who I can take care of. And that's just some of the limitations of being a spine surgeon. But overall, it's a fantastic job. One from an education standpoint, in that I can help spread information. A big thing I see about people being frustrated is they don't get to spend enough time with their doctors and surgeons. And that's part of the reality of healthcare in America today, is that we're on a clock. And so being able to spread information is big. And like I said, if I'm going to take care of somebody, I want to be able to take the time to help take care of them properly. And so it's really, back pain, neck pain, everybody gets it. If we can help in any way, click the link below. It's got some good information on it. Feel free to reach out to me. And I hope you guys have a great Monday and the great rest of your week. And please reach out if we can help. Bye.